All right, people, this is the lecture burst for Growth and Development, chapters 22 through 27. Okay? Growth and development is the actual physical growth of the baby. New cells are being formed at all the time. Development is the progressive change in the child toward maturity. Maturation is the completion of the growth and development to adulthood. And then cephalocaudal is the growth from head down, and then proximal distal is the growth from the center out. Physical, emotional, and cognitive growth during the first year of life is the actual milestones that you need to bypass. Usually growth from 2 days of age to a year. Infants gain about 1.5 pounds per month for the first 5 months. Birth weight usually doubles at 5 months and triples at 12 months. Height increases about 1 inch per month for the first 5 months, and then the birth height increases by 50% by the 12th month. Okay? So the emotional development, we use Erickson's stage for this age. For the age under birth to 1 year of age is trust versus mistrust. You have to develop the trust, and then consistency must be established. Infants who are consistently picked up when they cry tend to have fewer crying episodes, and they have less aggression when they're older, around 2 years of age, and that. So they're more well-rounded. Grasp reflex disappears around 3 months. Pretension occurs around 5 to 6 months. Parachute reflex is 7 to 9 months. Pincer grasp is about 1 year of age, and that develops all the way through the child's development there. It goes in succession. Direct the conversation with open-ended questions when you're talking with family. With infants, respond only to sensory stimuli and cues from others. With young children, only the caregiver to hold the child for a while and show that you're safe. An irritability cry, baby cries and may be difficult to soothe. Lethargic baby may shut down and sleep in order to avoid the excessive stimulus that's around them. School-age kids begin with calming down the child and connecting with them. Adolescents, they're hard to deal with sometimes because they want to be in control. They want to know what's going on, explain it to them. Don't force the issue, but sometimes they don't want people to know what's going on with them, so they have to be careful. Much of the information you may receive is from the family or caregiver. They are the experts with their child. Coping with an irritable infant. Sit quietly with the infant. Don't talk or sing. Eliminate as much noise in the environment as possible. Talk with a soft voice. Change infant's position slowly and provide nutritive sucking, like on a binky or your finger. Okay, immunizations, very important for children. Hepatitis B, if approved, give one first dose at birth. Then the second one is between 1 and 2 months of age, and then the last one is between 6 and 18 months of age. Rotavirus, as you can see, between 2 and 6. Tdap or DTaP is at different times during their life. Haemophilus influenza type B is given for 4 shots. Pneumococcal, polio, influenza is yearly. MMR starts between 12 and 15 months, and then again at 4 and 6 years. Varicella same time. And hepatitis A protects your child from those, so those are always helpful to get. Infant safety, car seats. The NTSB came out, probably 5 or 6 years ago and said that you needed to have all infants 2 years of age and less than 22 pounds to be rear-facing in the car seat. They have changed that here recently to where it is saying as long as possible. Birth to 12 months, your child under the age of 1 should always ride in the rear-facing car seat. There are different types of rear-facing car seats. Infant-only car seats, don't get the carrier type. Those are not the best to use. Okay. General characteristics, preschool growth development, must be able to pay attention while in class, 45 minutes. So, I mean, that should be working in your class right now. Progress from the skill of writing and reading to understanding written and or read things to them. Must work towards a delayed reward. Erickson's stage is a stage of industry. Okay. Physical growth slows until just before puberty. Weight gains are more rapid than increase in height. Brain has pretty much reached the adult size. Muscular coordination is improved. They fall less. Lower center of gravity. Get my tongue to work. Loss of primary teeth begins around age 6. 4 permanent teeth erupt per year. Play is a child's job, and so it involves increased physical and intellectual skills, and some fantasy culture of the school-age child involves membership in a group or some type, team sports, competitions, enables the child to feel powerful and in control. Mastering new skills helps the child have a sense of accomplishment. The 6 to 12-year-old, these guys are energetic, they're on the go, they're always moving, likes to start tasks but very rarely completes them. Talks for a purpose rather than for the sake of talking. Vocabulary is about 2,500 words. Requires 11 to 13 hours of sleep per night. Boys and girls play together but begin to prefer association with their own sex as far as play goes. Health examination usually begins in the spring, precede school admission. Food preferences occur. If inattentive at school, he or she should be screened for vision or hearing or language or learning disabilities, and that assess the physical activity and school performance is important. If ill, a school-age child can understand a simple explanation of his or her illness, needs time and place to study, and must learn to take responsibility for their own assignments in school. Moral development, they do not understand the reason for rules at the earlier age group. Judgment is guided by rewards and punishment at early age, and then develops ability to judge by purpose of the action and not the ramifications of doing the action. Adolescence, general characteristics. This period of development starts with the appearance of secondary sex characteristics. Ends with the cessation of growth and emotional maturity. Adolescents have 3 stages: early, middle, and late. Okay. They want to be accepted by their peers, the kids they go to school with, but they also want to be their own person. Time conflict with the family. Who am I? What am I here? What am I doing? What do I want to do? That's when they start this up. Okay. Major task, establishing an identity, separating from the family maybe a little bit at first and then progressing. initiating intimacy, developing a career choice. What do they want to do for the rest of their life? That's where most people start doing that. At this time, the hypothalamus signals the respective sex organs to start producing hormones directly into the bloodstreams. Androgens in boys, steroid hormones that promote male secondary sex characteristics. The two main ones are androsterone and testosterone. Girls, it is estrogen, a group of steroids that helps promote and develop the maintenance of female characteristics of the body. General appearance tends to be a little on the awkward side, long, lanky, leggy, because different body types, parts grow at a different rate, and that they mature at a different rate. Sweat glands are very active, might have an issue with body odor. Oily skin and acne are common. Sebaceous glands that are in your skin to keep the skin nice and soft also produce too much, and we get acne from it. Boys, puberty begins with hormonal changes between 10 and 13 years of age. Hair begins to grow on their face, chest, axilla, and pubic areas. Shoulders widen, pectoral muscles enlarge, voice deepens. Genitals increase in size and pigment change colors. Males grow till they are 18 to 20. Sexual maturation is testicular enlargement, pubic hair growth, penile enlargement, growth of axillary hair, facial hair, vocal changes, in that order. Okay? In that order. Erections and nocturnal emissions do occur. Important for to teach testicular self-exam for teenage boys. Girls, pubertal changes occur 6 months to 2 years before that of the boys. Easily recognized in girls by onset of menstruation. Secondary sex characteristics more apparent before menarche. First menstrual period is called menarche. Commonly occurs around 12 to 13 years of age. Fat is deposited on hips, thighs, and breast. Energy balance activity should be closely monitored for nutrition and what they need, especially once menstruation begins. Psychosocial development, a sense of identity, fluctuates during adolescence, molded by demand from a variety of people, family, peer group, whatever. Sense of intimacy, closely entwined with the resolving of the person's sense of identity. Period of trying and testing. Need practice in making decisions. Cultural and spiritual considerations. Sometimes they go with what the family wants, sometimes they don't. Realistic body images. They are always looking like everybody is looking at me. Why are they looking at me? Take pride in their abilities. Every effort is made to be like their peers. Okay, major theories, we've already talked about those, but here's a little bit more about those type of things. Peer relationships help with the adolescent feel like they belong. School assumes important role. Belonging to a group of extremely important. Cliques form. Develop close personal relationships with one peer of the same sex, vitally important in helping adolescents define themselves. Social norms and pressure exerted on the peers may cause problems. Sexual behavior must meet and become acquainted with a member of the opposite sex, if that is so deemed. Dating groups. They start out in groups, then they go to couples, 4, 5, 6 people, and then single couples that go out that way. Sexual experimentation often occurs as a response to peer pressure. can affect growth and development. Unplanned pregnancies and STIs are two major complications of adolescent sexual interaction because a few use protection. Challenging for the adolescent. For the state of Washington, by September 1st, 2008, every public school that offers sexual health education must assure that sexual health education is medically and scientifically accurate, age appropriate for students regardless of their gender, race, disability status, or sexual orientation. It includes information about abstinence and other methods of preventing unintended pregnancy and sexually transmitted disease. So they've actually done studies that have shown that this type of education does not increase the sexual activity of adolescents. Okay? Substance abuse. Best weapon against substance abuse is education. They need to conform. The need to be accepted, peer pressure, the emotional depression. That is often what happens with these children, or these young adults, I should say. Adolescents are prone to mood swings as they try to adjust to their physical and psychosocial changes. Nurse should assess for patient PACE, which is parent-peer pot. A is for alcohol and automobiles, is for cigarettes, and E is for education. If two or more of the PACE letters are problem areas, then the adolescent may be at risk for drug abuse, and appropriate referrals must be done. Okay, thanks for listening. Hopefully this was good for you.